So I'd like to tell you about some of the struggles I faced with my breast cancer encounter to help you get a better idea of what you may be facing. Real struggle was how to tell my children our shock. Getting over a diagnosis is never easy. And however, I am the type of person who takes action. And to me, that's how I got over that struggle. I just got it into gear and said, "This, I'm going to deal with this and be done with this." But my second real struggle was how to tell my children. At the time, they were 3 and 4 years old, and we really didn't want to say anything until we really knew what we were facing. So there was a lot of hush hush in the house, and my older son, who was 4, said, "Mommy, is one of your friends sick?" And I said, "No." And then he said, "Well, is one of your friends dying?" And I said, "No." And he said, "Oh, okay." And he let it go. And I said, "Would it be all right on Monday if Paris's mom picked you up from school because I have to go someplace and I might not get back in time?" And it was like he knew. He said, "Oh, absolutely." And I had never had anyone but myself pick him up from school. But we went right with it, and that was conviction to him that something's going on. And then, of course, when we were able to tell them, the younger one didn't understand, but the older one said to me, "Oh, you're going to go to the hospital." He said, "Are you going to go?" He had had some surgery about a year before that. So he said to me, "Are you going to go to the same hospital?" And I said, "Absolutely." And he said, "Are you going to have the same doctor?" He said, "Of course." And then he said, "Are they going to use the same tools on you that they used on me?" And I said, "Absolutely." And he said, "Well, then you're going to be fine, Mommy." I said, "Okay, great, terrific." So I think when you have small children, the best thing you can do is really understand who your child is or your children are and deal with them in the best way that you can help them to understand and allay their fears. So, of course, my third struggle was the physical side. When you have a bilateral mastectomy, which is what I had, you can't push a stroller, you can't pick up your children and put them in a taxi, you can't do things like wash your hair. I mean, you cannot put your hands up in the air. They just don't go up there to wash. So for that, I enlisted friends. I got friends to pick up my children, or at least I would walk with them. They would push the stroller. I got my husband would wash my hair in the sink. It was quite a production, a lot of fun. So that's how I got over that. And really enlisting help from others is a great way to get through that struggle and to move on.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.